Good morning to all of you. I love when people try to say that 3 or 4 times to get folks up and at them in the morning. I was at a conference a few years ago and I got from Walmart and everybody stand up and put their hands over their heads and really get the energy going. But I'm just glad you're all here and look forward to sharing with you some of what I have to say about consumer reproductive health plans. My name is Frank Holm and I come to you from New York, from the Health World Communications Company. I work as part of the global business group at Health World, and after we just come back from our spring meeting in Switzerland, we had 3 days of snow. So it's really nice to be here in Las Vegas in the desert sun. I received a correspondence from Skip, who I want to thank for inviting me back in December when Ibarra Johnson recommended that he contact me about this conference. Now, I'll have to admit to you all that when he contacted me in December about speaking about consumer reproductive health plans, I didn't know what they were. So I immediately did some research and found out what I could in the time I had to respond to them, and got very excited about the opportunity for what they were. I've spent the past 3 months doing a lot of research, looking into the trends that are being driven by consumer reproductive health plans and the opportunity for them to really be a driving force of changing consumer behavior in the United States. And the talk I'll share with you today is about how consumer reproductive health plans can really drive personal responsibility for healthcare in this country. We heard a lot yesterday about them having the potential to drive, to change consumer behavior. But there's also, that's the push side of the equation, there's a pull side too. Consumers have to take more responsibility for their health, and this is a way that's going to help, I think, awaken them to what the opportunity is. So I'm very excited about this area. I think what I have to share with you today is probably consistent with the views of many of you, but perhaps puts it into context. In terms of my own personal background, I came into the area of pharmaceutical promotion and direct-to-consumer advertising 12 years ago. I was hired into a company called Medicus Communications to work on Merck's first ever DTC campaign. And we're truly excited about the opportunity to go to work for Medicus and begin to handle this campaign. But what the managing director told me when we had our conversations about coming to work, he said, I feel we're on the cusp of being able to harness the power of consumer advertising to change behavior in healthcare in America. And that comment stayed with me very strongly in my early years of getting involved with DTC. I've been active both domestically and overseas for the past 12 years. I really see myself in a similar position as I was 12 years ago, just learning DTC. I'm just learning this area. But my expectation is to be an advocate for personal responsibility for healthcare over the next decade. And what I really believe, and I'll seek to support during the next 50 minutes, is that consumer reproductive health plans will play a significant and increasingly important role in driving consumer-centered healthcare, and both companies and employees will need to become more proactive and involved in the emerging responsibility revolution in healthcare over the next decade. What I'm going to share with you today is the following outline. I want to talk about the healthcare crisis from a macro perspective, not only cost, but also the implications of what's happening in healthcare today. Talk about the emergence of consumer-centered healthcare, show how consumer reproductive health plans fit the picture, why business needs to control the impact on pharma, and I'll close with 10 trends that we can watch for as adoption advances. The basic idea that I have about how this is going to work, and again, this may be quite obvious to many, is that we are in a crisis situation with healthcare. Consumer-centric healthcare is the key to transformation. CDHPs can help drive that responsibility, and companies will need to take the lead. I think my experience in coming into this 3 months ago, not knowing anything about it, is quite different than the folks here. But there is a huge market outside this conference that still needs to be educated on the power of consumer reproductive health plans, whether they are at the employer level, the consumer level, the marketer level, or the communication services level. We need to get a grip on why this is important and what we can do to advance the game. It's going to happen, but it can happen faster and better if everybody's informed. Let's talk about the current healthcare crisis. I want to just top line some key issues. Costs are high and increasing. Health insurance is going up at double-digit rates for the past 3 years. The current medical model is generally inefficient. Quality is an issue, and I'll touch on a huge problem, and that's obesity, basically the poster child for the problem. So first, some numbers. These are stats from the National Health Statistics Group showing the projected rate of change for spending in healthcare in the U.S., both on a percent of GDP and on a projected total spend basis. And we're looking at over $2.5 trillion by the end of the decade, and about 17% of our gross domestic product is projected to be consumed by healthcare. It's the largest single line item in the budget. Those numbers are huge, and how can you get your hands on trillions of dollars? So if you bring it down to a per capita basis, we're currently somewhere around $5,500 spent per person per capita in the U.S. in 2004. That's projected to rise to over $9,000 per capita by the end of the decade, an increase from today of 60%. So those are huge figures. When we take a look at the U.S. versus any other industrialized nation, we are by far the biggest spender on a per capita basis of healthcare. The 2001 figures have us at nearly $5,000, about $4,900. The next two markets behind us that are over $3,000 per capita are Switzerland and Norway. So we're way ahead of what we spend. The question is going to be whether we get our money's worth. In terms of health plan premium costs, there's been a lot of discussion about this, and I think that's obviously a driving force towards CDHPs. But we've had double-digit increases for the past 3 years. Last year, we were up 13.9% versus a year ago. And if you compare that to some of the figures below, workers' earnings have actually declined for the past 2 consecutive years, and then general inflation is up moderately. We're increasing at a rate 6 times the CPI. When we take a look at what it costs for a single individual for an employee-sponsored health care insurance plan, about $3,400 per year, and for a family, we're up over $9,000 a year in payments for an employee-sponsored health insurance plan. And of course, there's been a lot of talk about various companies that get hit hard in this area. General Motors is by far the most widely noted example. Even though they've lost 180,000 employees over the past 10 years to attrition and other reasons, they reported last month that their long-term liabilities are now up over $60 billion. They spend $5 billion a year to handle their employees and retirees, and that amount is about more than $14,000 per employee. It was noted yesterday that General Motors is currently spending more on their health insurance than they are on steel to make cars. There are many other stories of companies who have faced similar problems and are now looking for solutions. But it's not just about the cost of healthcare. Waste and inefficiency are rampant. We have poor quality leading to bad outcomes, and the obesity problem is adding significantly to stress on the system. Look at the issue of waste and what this country spends on bureaucracy. The New England Journal published an article last summer noting that in 1999, the U.S. spent 31% of that expense that we noted earlier on bureaucracy. We compare that to what's happening in Canada, they're just about half on a percentage basis of what the U.S. spends. And if you take a look at the people that work in that area, administrative and clerical personnel, the U.S. has increased 9 percentage points over the past 30 years, and over a similar time period, Canada has increased their workforce in administrative and clerical personnel by only 3 percentage points. So we're spending a lot of time pushing paper instead of dealing with patients. And when we take a look at the outcome and the quality of care, the New England Journal also published last summer a story from of a RAND Corporation review of 6,700 adults, not only in interviews, but they reviewed the charts of 6,700 adults in 12 cities, and determined that only 55% of them received recommended care following the guidelines. There's a lot more detail from this study, but another one talks about actually deaths that could be avoided. NCQA wrote in their report that the healthcare system actually leads to 57,500 avoidable deaths each year. And they broke out the information by disease state. And if you take a look at the disease areas in which deaths occur that could be prevented, there are areas where responsibility is not only on the doctor side and the healthcare professional side, but also on the consumer side. Blood pressure control, diabetes care, cholesterol control, and smoking cessation are the top 4. Those are all areas where consumers can take a greater role in their own care. But we are doing a relatively poor job of taking care of ourselves. When you look across the number of disease states, but this one is paramount. Obesity in the U.S. is a huge problem. 2/3 of the nation is overweight. Almost 1/3 are considered obese, and 4.7% of this country, adults, are morbidly obese. That's 9 million people. And one expert made the observation that if we continue at the current rate of growth of obesity in this country, 95% of the population will be obese by the year 2040. And obesity is causing us some significant problems. It's linked to 300,000 deaths each year from diabetes, arthritis, and heart disease, which makes it the second leading cause of preventable death. You probably saw the article last month about it. Creeping up on smoking, probably overtake smoking in the next report. Yet Americans spend $40 billion every year trying to lose weight and really truly reveal sustainable success. Obesity also costs the nation $117 billion each year, which is more than we spend on all forms of cancer. I've never seen the per capita figure, and a lot comes out of our pockets every year to take care of the problem in taxes. So, with costs rising, quality suffering, and our health risks increasing, what is the solution? In the 90s, the answer was managed care. That was going to help us cut costs and raise efficiency. But we see managed care's focus on cost savings has really diminished the value of health care. And we'll talk specifically about that in a few minutes. What managed care led to was really reinforcing the support of the U.S. medical model. The model in which health insurers are the ones who pay health professionals and the ones who approve the drugs in the pharmaceutical industry. And pharma is the one who promotes it to healthcare professionals and seeks to get on formulary with the health insurers. Healthcare professionals rely on the other two to really accomplish their role in disease treatment. And if you take a look at this model, it basically feeds and protects itself while resisting change. Most of the model resists change that's going to be thrust upon it. Why? Take a look at the docs. They're trained to solve problems and treat disease, not really deal with issues of wellness and opportunities for consumers to take better care of themselves. What they mainly use as their tools are drugs and surgery. Look at pharma. Their profit relies on selling more pills. They actually benefit from higher incidence of disease, though nobody would say so. And health insurers, they do want to keep their costs down in the short term, but have little long-term view. Now, I believe as we evolve towards more adoption of consumer-directed health plans, that point will change significantly, and that has to be a place where it starts. My view is that the solution is to put more control in the hands of the consumer. And I'll share with you views from two prominent thought leaders in this area that set the stage very nicely. First, I'll talk about the emergence of consumer healthcare, consumer-centric healthcare. Some points. Consumerism is the key to this. I'll share with you the 4 pillars of consumer-centric healthcare that will make it work. Discuss the fact that the true price of healthcare is not known. That's been discussed. And that relevant information to the patient and consumer is truly essential to be able to take this forward. Well, here are the 2 comments. Professor Regina Hurlitzer of Harvard has written a book called Market-Driven Healthcare, and she's about to publish a second book called Consumer-Driven Healthcare. Her comment is straight on. The health industry has been shielded from consumer pressure by employers, insurers, and the government. As a result, costs have exploded as choices have narrowed. When consumers control any industry, competitive forces spur productivity and innovation. Quality improves, choices expand, prices fall. Newt Gingrich has also written a book on the subject called Saving Lives and Saving Money, and he has formed a group called the Center for Healthcare Transformation. He has some smart ideas on what should be done. His comment: the dominant model of the 21st century will be more choices with better quality and lower cost. This is already true in nearly every other segment of the market, and it's what the American consumer over the last decade has come to expect. However, in healthcare, this market dynamic is absent so far. Here's what I believe are the 4 pillars that will make consumer-centric healthcare really come about, and it will have to be adopted. We need to have personal responsibility for healthcare, and that comes from the patient and from the employer. Enhanced choice. It's not all about go to your doctor and get a drug. Relevant information about what that enhanced choice might be and about what disease state they need to learn about and what should be done about prevention. And then clearly a solid understanding of and meaningful understanding of the price-value relationship of what they're getting for their healthcare dollar. It was raised yesterday that consumers really don't know much about the true cost of healthcare. And actually, doctors don't, and insurers don't, and it's a black hole that has been kind of dictated by the way we have had to come to terms with paying for healthcare. This fellow, Anand Gupta, who is a doctor, writes very poignantly on the emerging consumer-centric healthcare revolution. He makes these 3 points. The problem in healthcare is that medical services are nearly free at the point of service, so doctors and patients have an incentive to use as many services as the health insurer will pay for. He points out that consumers have developed the misconception that it only costs $10 for an office visit, and the difference between a generic and a branded drug is $5. They have no real incentive to monitor or exercise control over their healthcare use or spending. And I think this is a really apt point, that consumers spend more time comparing features, test driving, buying and financing an automobile than they do in learning about or selecting their healthcare benefits. It's a very right-on statement. And if you take a look at the information that consumers do have to be able to make decisions about their healthcare, it is lacking and they don't use it. The Journal last week, I guess last month, published a story with the headline, "Consumers are miserably armed right now to make judgments on quality." Harris Interactive did research and found that people who have seen information that rates hospitals, health plans, or physicians were less than a third, and people who actually made decisions or changes based on those ratings were minuscule on the ratings, were either 1 or 2%. So the information is not there, and consumers are not using it. Let's talk about personal responsibility for healthcare. Professor Holitzer again. She says consumer-driven healthcare will ultimately correct healthcare inflation. The reason is quite simple. Consumer-driven care will bring about prudent consumer spending and increase productivity. We must bring higher productivity to the healthcare sector, and that will come from the bottom up, from consumers acting in their own best interest with providers responding. So, with that as kind of a backdrop to consumer-centric healthcare, how do CDHPs fit into the picture? Let's define them, talk about growth, and explore how they can serve to empower the employer. Well, we heard some definitions yesterday. In fact, there were 2 sessions yesterday morning that went into a lot of detail. I'll just top line a couple slides here. Most plans include cost-sharing provisions, high deductibles, an HRA, an HSA, and tools and resources to help workers become smarter healthcare consumers. They also allow organizations to give workers greater flexibility in making decisions about their healthcare benefit coverage. And HSAs under the Medicare law should contribute to the implementation of these newer high deductible plans. And paired with high deductible plans, HSAs can drive employees to be more price sensitive when they purchase healthcare. Some numbers from Watson Wyatt show that it's very small right now, the number of consumers who are actually engaged in consumer-driven healthcare plans. It's tripled in the past year. Yet going forward, about a third of companies are looking to expecting to offer a CDHP towards the next year, and it's up from just a fifth of companies last year. Now, when we think about the consumer and the consumer driving the change, what are some of the factors that have to come into play in encouraging them to take greater personal responsibility? Well, they need an understanding of price value. They must have relevant consumer information, relevant healthcare information. They really have to understand more about wellness and prevention. It's so under-leveraged in this consumer marketplace. Alternative therapies are also kind of in the closet for most consumers, and we're looking at choice, quality, and accountability as important factors in making this come about. Well, one expert, Devin Herrick at National Center for Policy Analysis, says he expects consumer-driven plans may account for as much as half the market for employer-sponsored health insurance within the next 4 years. I think it's a very aggressive statement, but it's a statement that suggests that the opportunity for a true revolution in this area is huge. Now, how about what they can do with and for consumers? Consumer-driven health plans have one common objective: to involve consumers in the decision-making process in a manner that will drive down the cost of healthcare benefits without limiting quality of care. That's Dr. Gupta again talking about in his article, Revival of Consumer-Centered Healthcare. Now let's bring the story around to the role that business has to play. Because business has basically taken a back seat to what has happened in the managed care era over the past decade. But today is business's opportunity and really mandate to help drive the change in the healthcare system. For them, controlling costs is key. In fact, it's their number one objective. CDHPs can offer real savings. Wellness will integrate well and actually provides ROI for dollars spent on wellness programs and the other benefits that happen too. Let's hit on one kind of macro view that came from a policy analyst, Brian Hubbard, that talked about the fact that we can't rely on Washington alone to help drive change. He says the dynamics of American policymaking render massive social change nearly impossible. Healthcare's $1.6 trillion annual flow distributed through a highly fragmented industry makes it particularly attractive. Powerful groups promote their interests without regard for consequences on a larger system. Virtually any worthwhile proposal threatens some special interest and creates resistance to change. Well, clearly there are some good things happening in Washington. There are opportunities to use some of the legislation that's passed, but there has to be more pressure. And the pressure can really come on business to the insurers to help drive the needed change and break up the monopoly of the U.S. medical model. We talked about cost. Today, a survey from Deloitte & Touche, actually last month, reported that controlling health and welfare costs was one of the 86% said it was one of the top 5 priorities, and for 67% of respondents, these are employers being surveyed, controlling health and welfare costs was the number one objective. It's what they're looking to do to help move their business forward. We've heard a lot about cost shifting, and what has happened over the past 4 years is that the move towards putting more of the burden on the employee has significantly changed. At the start of the decade, 52% of employers were willing to absorb healthcare costs. Now, 4 years later, less than a third are willing to absorb healthcare costs. So they're clearly looking to pass on, but they need to pass on in a format that makes sense for both the employer and the employee, in a way that keeps the employee happy and delivers a better return to the employer. Now, what are they doing? How are the employers dealing with this rise in healthcare insurance premium? 70% in a survey that Watson Wyatt did say they will pass on some of the rising costs to employees. 63% moving toward a greater use of the internet to administer and communicate healthcare benefits. 54% said they'd shift purchasing decisions to employees if health plan liability legislation were to pass.